Hey everyone, I'm at home now. I was released from the hospital at I think it's about 5 o'clock tonight. They were going to keep me again, but my labs for my calcium came back steady and climbing, so I decided to send me home with some calcium supplements. Talking a little better. It's been probably a little over 6 hours since I've had any pain medications, so I'm probably going to take some pain meds here in a little bit and go to bed. So I got home and took a shower, which was nice, patted my incision dry, and got dressed and fell asleep. So I was sent home with some prescriptions. This one's over the counter, but I have to take Oscal, which is my calcium supplement. It's got D vitamins in it as well, and I have to take 4 pills a day, so 2 pills twice a day with food. And then this is my thyroid medication. Right now I'm still on the same dosage that I was on before I had my thyroid out. I'm sure this will change once I see my endocrinologist on Wednesday. Right now I'm just on 75 mcg of levothyroxine. And this is cephalexin. This is an antibiotic they have me on. I have to take 1 pill 3 times a day till I run out, 10 days. So this is for any infection, to fight off any infection. And then of course my lovely Vicodin, which has been my savior since the morphine wasn't cutting it. Vicodin saved me with the pain. Overall, right afterwards was painful. I'm not gonna lie to you. It did hurt. The first night, the second day hurt as well, but the Vicodin, once they started giving me Vicodin and I could swallow the pills, was, the first few got crushed up and put onto some Jello, which wasn't the greatest thing, but I needed the pain meds, so I went ahead and did it. Pardon me, I have no makeup on. I just took a shower, threw my hair back, and here I am. And I just woke up from a nap too, so I'm kind of groggy looking. So the Vicodin helped with the pain, and it helped me be able to swallow and sit up and move and function a little bit better. Pain is not nearly as bad now. It's probably very tolerable even without pain meds, but I'm going to go ahead, since I'm going to sleep here soon, I'm going to take some, and hopefully that'll aid me in sleeping a little bit better, since I didn't exactly get a whole lot of sleep in the hospital. Oh yeah, and I have to take my multivitamin. He wants me to go ahead and keep doing that. I'll show you my incision here in a minute. I'm also still doing this thing 10 times, I guess 10 times an hour, although I don't quite get there. I just do it whenever I think about it. So the instructions said to keep the incision dry. I can go ahead and take showers, pat it dry afterwards, and I have to put Neosporin on it twice a day. So here we go. I'm going to show you my incision. And it's a little red because of the tape that was on the bandages, so I had a little red reaction to the tape. So it's a little redder than it should be. I'm sure in the next few days that'll go away and it won't look as red and bad. So there's a little bruising on top of my incision where they had to hold the skin back so they could take my thyroid out. This right here is where the drain was. I've got a little Donald Duck band-aid on it because it was still kind of losing a little bit of stuff, so I put that on there. I'm sure by tomorrow it'll be done and I'll be able to have that off. It's just a little bitty hole where the drain was. So it doesn't look that bad. And I think the pain, the incision doesn't hurt as bad, I don't think, as the bruising does. That's where most of my pain came from. And I think you can see all my redness from the bandages as well. They had a bunch of tape on me from holding. They didn't have a tube that the drain went into. They just had a whole bunch of gauze put on here, and they taped it all on there, so the tape really stuck to me. And my had a little bit of a bad experience with the assisting surgeon. He came in to see me first, and he was pretty rough with me. He grabbed my head and shook it around and asked me if it hurt, and of course it hurt because you're, moving my head around. And then he just yanked everything off. He yanked all the, not very easily, not gently at all. He just ripped all the tape off, all my bandages off, and took the drain out, and to which the drain decided it wasn't done draining, and it drained all over me. And that was like, I think it's the clear fluid that they use to when they're cleaning your incisions out when they're doing their surgery. You know how they, I don't know if you've ever seen a surgery on TV, but they always flush you out with liquids. And it was mostly, hi cat, it was mostly clear liquid with a little bit of blood. So it wasn't anything. When it first came out, I couldn't look down, and I thought I was just bleeding everywhere, and they assured me that I was not until I finally looked down and it wasn't blood. So, and then I had it leak one other time. I had taken a nap and I got up to go use the restroom, and it leaked all over me again. So they changed my bandages, and after that I was good. The cat and the dog are having fun. So I think overall everything is good. My pain is tolerable. If you're going to go through this process, once you get through the first day, 2 days, you're good. Just don't go in thinking that it won't be painful, because it will be painful. And I think most of my pain was from the back, like I said in one, I think it was my first video, the back of my neck here, which is still kind of tender. If I could rub on it a little bit, it'd probably help. From having your neck back the entire surgery, it kind of cramps up those muscles, and it felt like I had a migraine in the back of my neck, the back of my head, from those muscles being tensed up for so long during the surgery. And then the bruising hurt. So I'm going to take some pain pills, and I'm going to go to bed. And if I have anything new going on tomorrow or in the next few days, I'll do another video. But I don't think I have anything new until Monday. I'm going in to get my sutures removed. And at that point, he'll probably put the steri strips on, I'm guessing. He just used sutures, no staples, no nothing. And then Wednesday, I'm going to see my endocrinologist. My labs did come back benign. I have no cancer. Yay. I don't have to worry about doing radiation or anything. So, good to be home. I'm going to go get in my bed, hopefully get some sleep, and get some rest and heal up. Talk to you guys later. Thanks.